This is Dr. Ranjan. Welcome to Applied Veterinary Medicine channel. Let's talk about bovine hepatic diseases associated with trematodes named FASCIOLOSIS, also called liver fluke disease in cattle. Etiological agents are FASCIOLA hepatica and F. gigantica. Epidemiology: infection by ingestion of Metacercaria on herbage, geographic. Distribution, seasonality, and disease risk determined by occurrence of intermediate hosts, limnaeid mud snails. Signs: acute syndrome, sheep; sudden death, chronic syndrome, sheep and cattle; weight loss, reduced milk yield, pallor, and submandibular edema. Acute fasciolosis in sheep, mostly found as sudden death without other apparent clinical abnormality. It occurs in the summer and autumn but can be found at any time when sheep have the opportunity to graze heavily contaminated grass as food. The disease shows following clinical signs: dullness, weakness, lack of appetite, pallor and edema of mucosa and conjunctiva, pain when pressure is applied over the area of the liver. Death is seen along with the blood-stained discharges from the nostrils and anus. Subacute fasciolosis found in sheep with clinical signs of weight loss and pallor of the mucous membranes. Submandibular edema in only a few cases, but many animals will present palpation over the region of the liver. Disease outbreaks occur usually of relatively short duration of 2 to 3 weeks. Acute fasciolosis rarely occurs in cattle. Chronic fasciolosis takes several weeks or 2 to 3 months after the acute disease. Affected sheep show clinical signs of weight loss and submandibular edema, also called bottle jaw, pallor, mucosae and alopecia. Many animals survive in poor condition for longer periods. Cattle show clinical signs with weight loss, especially if lactating. Low milk production and anemia may develop. Clinical pathology: acute syndrome, raised serum glutamate dehydrogenase concentrations, anemia. Chronic syndrome, characteristic eggs and feces, anemia, hypoalbuminemia, raised serum, and gamma-glutamyl transpeptidase concentrations, lesions. Acute syndrome, pale friable liver with parasitic tracts and hemorrhage. Chronic syndrome, fibrous liver, bile ducts grossly distended and thickened. Diagnostic confirmation: acute syndrome, immature flukes in liver parenchyma as necropsy. Chronic syndrome, characteristic eggs in feces and immunoassay of blood, milk, or feces. Treatment 1. Oral triclobendazole is used specifically against Fasciola hepatica in sheep, 10 mg per kilogram, cattle, 12 mg per kilogram for F. gigantica in buffalo. It is a drug of choice against all stages of fluke from 2 days old in sheep and 2 weeks in cattle. If necessary, repeat the dose 8 to 10 week interval. To overcome the resistance of fluke to triclobendazole, use combining compounds suggested against immature stages of flukes. An example: SC-chlorsulon, 2 mg per kilogram and nitroxanil increases efficiency up to 99%. Treatment 2. Albendazole, a broad-spectrum compound, is effective against adult F. hepatica at an oral dose rate of 7.5 mg per kilogram in sheep and 10 mg per kilogram in cattle. It also kills any F. hepatica eggs present in bile ducts or the alimentary tract. Netabimin, 20 mg (PO), is metabolized to albendazole in the body and has similar activity against F. hepatica. Treatment 3. Clozental kills the flukes older than 4 weeks in sheep at an oral dose rate of 10 mg per kilogram (PO). Treatment 4. Chlorsulon is used in combination with ivermectin against fluke and roundworm control in cattle at dose rate of 2 mg per kilogram by subcutaneous injection and is effective against adult and 12 to 14-week-old immature flukes. Treatment 5. Nitroxanil is used subcutaneously at 10 mg per kilogram against the adult fluke, but an increased dose up to 50% is adequate control of acute disease. Treatment 6. Oxyclosinide at dose rate 10 mg (PO) has a significant effect against adult fluke but not against immature forms. It may cause transient softening of feces. With levanosole, it is effective against fluke and gastrointestinal nematodes as well. Control avoidance or drainage of snail habitats, strategic anthelmintic dosing program. Precautions: dose and duration depends on cattle body weight and disease condition. Apply medicine carefully. Thanks for watching.